Every year, October 29th is World Stroke Awareness Day. Minutes can save lives. Learn the science, say it's a stroke, save precious time. Stroke is a neurological disorder where the blood supply to the brain is cut off. It is of two types: ischemic stroke, where the blood vessel is blocked due to a clot; hemorrhagic stroke, where the blood vessel is ruptured, thereby causing bleeding into the brain. How do I identify stroke? Stroke is a neurological disorder which can cause sudden symptoms. We usually go by a mnemonic called B fast, where B stands for any sudden imbalance, giddiness or vertigo. E stands for loss of vision in one eye or both the eyes. F stands for facial droop or facial asymmetry. A stands for arm weakness or leg weakness. S stands for speech disturbances or not able to speak, whereas T is the time we need to be alert and then rush to the hospital immediately. What are the acute treatment options for stroke? Stroke is a condition where the blood supply to the brain is cut off. If a patient comes within 4.5 hours after the symptom onset, we do a scan, then we label it as a ischemic stroke, then we administer a thrombolytic agent whereby lysing the clot. If he comes within 24 hours and if there is any major blood vessel block, we do have options called mechanical thrombectomy. There patient is shifted to the cath lab and then the clot is removed. 1 in 4 of us can develop a stroke. Stroke can happen at any time to anyone. 90% of strokes can be prevented. Avoid smoking, quit alcohol, maintain a healthy lifestyle, 30 minutes of exercise per day for 5 days a week, monitor your blood pressures, monitor your diabetes, avoid stress, do have a healthy diet.